Hi, and thank you for joining our educational webinar with Dr. Jennifer Salluzzo, who will discuss the medical and surgical options that can help you reduce and maintain a healthy weight. My name is Sharnice Smith, and I am a member of VCU Health's marketing team. So before we get started, I'd like to first make note that we'll hold all questions until the very end. So please feel free to drop your questions in the comments area and we'll address them during our Q&A. So I'd like to now introduce Dr. Jennifer Salluzzo. She specializes in minimally invasive surgical procedures using small incisions, tiny cameras, and robots to treat diseases of the esophagus, stomach, gallbladder, and intestines. She is also a weight loss surgery specialist, helping those struggling with obesity. Dr. Salluzzo also leads our hernia program, a collaborative and multidisciplinary team of physicians from across the health system working together to treat basic to complex abdominal wall hernias. Dr. Salluzzo attended medical school at Tufts University School of Medicine and completed her residency, internship, and fellowship at Yale University School of Medicine. Thank you, Dr. Salluzzo, for joining us today.
Thank you. Thank you everyone for listening in. I am going to be discussing obesity and weight loss surgery today. Next slide. It's interesting that in the past, obesity was quite rare and was actually a sign of status and wealth. A lot has changed since then with the obesity epidemic. Next slide. When I discuss obesity today, I'm going to be referring to body mass index. That is the relationship between your weight and your height. For obesity, a body mass index has to be over 30. And for weight loss surgery, your body mass index will have to be over 35 or 40. And I'll discuss that a little bit more later. If you're interested in finding out your own body mass index, you can look on the National Institute of Health website and use their calculator. Next slide. Excuse me. If we look over time at the prevalence of obesity in our country, we see that it has drastically increased. In some states, it is around 30%, and that's the red area. And as that has grown over time, the obesity epidemic has grown as well. About 40%, next slide, 40% of the US population is considered obese with a BMI of greater than 30. And that is largely represented in the Hispanic and Black population. Next slide. We've done a lot of work in the obesity arena trying to make people understand that obesity is actually a disease and it affects the body in many ways. Next slide. Obesity has tremendous physiologic impacts on every major organ system. From the head down to the toes, it can change every aspect of your body. It's related to heart disease, diabetes, pulmonary disease, cancer, and ultimately decreased mortality. Next slide. There have been a lot of hypotheses about why the obesity epidemic has occurred and why it's progressed. Some say that it's because we have an increase in consumption because food is more available and we don't have to travel to find it. Next slide. But there's something interesting that happened in the 1980s. We were all given this pyramid, which I'm sure you remember from school, where food was broken up into various nutrients, with carbohydrates being the largest block on the bottom, and fats and proteins being used sparingly up at the top. And this was thought to decrease the risk for cardiovascular events. What they didn't take into account is that when fat was taken out of foods, it was replaced with carbohydrates. And a lot of those carbohydrates were refined sugars, white flour, and not healthy foods. Next slide. Ultimately, the nutrition guidelines were revamped, and the 2015 to 2020 guidelines now have removed the ban on fat, with the exception of saturated fats. Next slide. Some of you may have heard of the Mediterranean diet, and this actually has a basis in research. About 7,000 people were given a diet that was supplemented with extra virgin olive oil, nuts, or they were placed on a low-fat diet. And after time, they measured cardiovascular events. And they found that the individuals who were supplemented with the healthy fats, extra virgin olive oil and nuts, had fewer cardiovascular events, with extra virgin olive oil being better. Next slide. So now that the nutrition guidelines have been changed, how are we doing? Overall, we are not doing great. We are far below goal in the nutrients that are healthy: fruits, vegetables, whole grains, proteins, healthy fats. And we're definitely above goal when it comes to the unhealthy foods: refined sugars, saturated fats, foods that are high in sodium. Next slide. So I'm going to spend the rest of the presentation really discussing weight loss surgery. Many people try dieting and are unsuccessful, or they lose some weight and then gain it back. And this can be a vicious cycle. This is particularly difficult for patients with morbid obesity, and that's where weight loss surgery comes into play. So I'm going to discuss about candidacy, what the surgical options are, and the outcomes related to surgery. Next slide. When it comes to patient selection, the patients who are welcomed into the program and who are very successful are people who failed another weight loss strategy. Many people have tried Weight Watchers or Herbalife, various programs. So you need to have tried at least one of these in the past. You need to have a BMI of greater than 40 if you have no weight-related medical problem, or greater than 35 if you do. And that would be diabetes, high cholesterol, sleep apnea, hyperlipidemia. We want well-informed and motivated patients who are ready to make a change. We do have to make sure that it's safe for you to have a major surgery, and so you have to be an acceptable operative risk. You do have to be able to move around and be ambulatory, and you need stable housing. And we do not allow any smoking for any of our patients preoperatively or postoperatively. Next slide. The surgical options that we provide are the Roux-en-Y gastric bypass and the sleeve gastrectomy. They're both done minimally invasively, which means with little incisions. The gastric bypass has been around quite a long time, and many of you may be familiar with it. In that surgery, a very small pouch is made out of the stomach, and then the large stomach is bypassed with a piece of intestine. So food is going to go a slightly different direction than it had previously. In the sleeve gastrectomy, the floppy portion of the stomach is removed, and it's taken out of the body and it doesn't come back. Food will go the same direction, but through a tubular stomach instead of the larger stomach. Next slide. If you look at the picture on the left, this is inside the abdomen. The top of the picture would be at the head of the patient, and the bottom would be looking toward the feet. On the left side of the picture is actually the right side of the patient, and that's the liver. You can see a white sponge there, and right below that white sponge is the pouch that was made out of the longer stomach, and that is attached to a piece of intestine. And through that connection, that's where the food would go from now on. On the right side, you can see that connection from the inside of the stomach going into the intestine. Next slide. With the sleeve gastrectomy, on the picture on the left, you can see that there's a darker tubular structure on the right of the picture. That is the specimen. That's the portion of the stomach that has been removed. On the left, and in the picture on the right, you can see what's left over is a pink, smaller tubular stomach. The specimen has been taken out, and now the patient is left with the tubular stomach, which is smaller, to allow for weight loss. Next slide. A lot of people worry about outcomes after surgery. There have been a lot of stories over time, and in its infancy, bariatric surgery was a lot less safe than it is currently. But overall, we have very low perioperative and long-term complications. You can expect significant weight loss and remission of many comorbidities, including diabetes, hypertension, high cholesterol, and sleep apnea. And you're certainly going to have decreased mortality. Like with any surgery, though, there are some risks. However, just to put it into perspective, the risk associated with a bariatric surgery is actually less than that associated with having your gallbladder removed or your appendix. And the risk of mortality from this surgery would be less than 0.5%, which is also lower than that associated with having your gallbladder or your appendix removed. But when we look at the risks, mortality being relatively low, we do see some others that come up, and these include leak, bleeding, blood clots, narrowing of the connections that we've made, and the potential for a reoperation. All of these would be discussed with your surgeon when you discuss the surgery that you're interested in, but keep in mind that these are all relatively low risk. Next slide. When it comes to weight loss, people can lose anywhere from 50 to 70% of their excess body weight. A lot of that is in the first few years, but we do see long-term success and long-term weight loss. If you look at the graph, you can see that the patient's weight starts high and then it drops. Now, there is some point where some weight does come back for patients, but overall they are significantly lower weight than they were when they started. Next slide. One of the greatest things about weight loss surgery is the mortality benefit. We see that patients are living longer. If you look at the graph, on the top would be patients who would qualify for surgery but don't have surgery, and the bottom line are patients who've had surgery. These people over time have less mortality than their counterparts without surgery. So they are living longer and they're living healthier lives because they've decided to take the step towards moving into surgical weight loss. Weight loss is really the only treatment proven to provide substantial and long-term weight loss in individuals with severe obesity. While there are medical treatments available, surgical weight loss still has been proven to be the best option for patients who are considered good operative risks. Despite this, only about 0.5% of the eligible population will actually pursue bariatric surgery. And this is something we are really passionate about working on. We want people to be aware that this is an option and to understand that they're not alone in the process, that they can take control of their health and move toward a healthier life with weight loss surgery. We want people to ask questions and utilize us and ask, what is it all about? What are the surgeries? What's available to me? We're happy to sit down with anybody and discuss it. Obesity is a significant problem in this country, and it's not going to get any better unless we all work together. So at this point, I'm happy to take any questions.
Thank you, Dr. Salluzzo. We're now going to open the floor for questions. We're first going to read some questions that were submitted in advance. So the first question that we have is, does weight loss surgery guarantee permanent weight loss?
That's a great question. It does not guarantee permanent weight loss. Bariatric surgery is a tool. It's one of many tools. But in order to be successful, you do have to be willing to change your lifestyle. That includes eating well, exercise, and as time goes on, some habits tend to be a little bit more difficult to maintain. But that's why all of the bariatric patients are followed indefinitely, and we work with them all to maintain healthy lifestyles so that they can have permanent weight loss.
Okay. Thank you. The next question we have, will I need to take nutritional supplements following a weight loss surgery?
That's a great question. So vitamin deficiencies are a risk of both surgeries. And because of that, we do recommend that patients take a series of vitamins. However, there are options where those vitamins are available in a single pill form through various companies. But yes, nutritional supplements are absolutely indicated after the surgeries.
Okay, perfect. And the next question, will weight loss surgery affect my ability to become pregnant?
Also a great question. So it does not affect your ability to become pregnant. In fact, when patients lose weight, their fertility can actually increase.
Wow, okay.
With that being said, we recommend that patients wait at least 12 to 18 months after a bariatric surgery to become pregnant, because we want to have the advantage of the bariatric surgery and the weight loss immediately after, and that wouldn't necessarily be safe for the mom and the baby if they're actively trying to lose weight while pregnant.
Okay. Thank you. And then the next question we have, is it common to need plastic surgery following weight loss surgery?
So need and want are a little different.
Right.
I think every patient who loses 100 pounds will have some extra skin.
Okay.
And it really does depend on the individual and how the skin exists on their body as to whether or not they want to pursue plastic surgery. I've never had someone say they wish they hadn't had bariatric surgery because they had some extra skin or needed to have plastic surgery. That being said, it is definitely an option and certainly available to patients if they want to pursue that.
It's good to know. And then the last submitted question that we have, does insurance typically cover weight loss surgery?
The majority of insurances do cover it. However, if you get your insurance through your company, you do have to make sure they have something called a bariatric rider, which means they have elected to cover bariatric surgery.
Okay,
Medicaid and Medicare cover bariatric surgery, though.
perfect. And then just double checking to see if we have any additional questions. Awesome. Well, thank you so much, Dr. Salluzzo. It was such a pleasure having you join us for this educational webinar. And I'm glad that we had the opportunity to discuss the medical and surgical options to help reduce the risks that are associated with being overweight and obese.
Thank
So
you.
to learn more about Dr. Salluzzo and the medical weight loss program at VCU Health, please visit vcuhealth.org or follow VCU Health on Facebook. And once again, thank you, Dr. Salluzzo, for joining us tonight, and to everyone else who joined, have a great night.
Thank you so much.
Thank you.